Good afternoon. We are about to get started with our training session. Thank you for everyone for being here. Thank you to our esteemed panel of speakers. We appreciate you being here. So we are going to go ahead and move forward with introducing our speakers. First off, we have Tonya Piephoff. She is the Director for the Division of Developmental Disabilities for the state of Illinois. Tonya has a bachelor's degree in social work, a master's degree in mental health counseling, and has dedicated her career to serving individuals with developmental disabilities and mental illness. Tonya has spent the majority of her career working with individuals with developmental and intellectual disabilities in both state-run intermediate care facilities, SODCs, and in the community and services through waiver programs. Tonya has also worked for many years in the forensic psychiatric system. Before coming to the Illinois Department of Human Services, Tonya served as the director of the Kentucky Division of Intellectual and Developmental Disabilities and as the chief operating officer of the Missouri Division of Developmental Disabilities. Tonya has over 20 years experience in assisting individuals and their families to find the best living environment to meet their individual needs and goals. Next, we have Josh Evans. Josh became president and CEO of IARF, Illinois Association of Rehabilitation Facilities, on April 1st, 2018, after nearly 15 years working to advance the budget and policy priorities of the association through the Illinois General Assembly and United States Congress. During his tenure as Vice President of Government Relations and Operations, Legislative Director, and Legislative Liaison, Josh led IARF efforts to pass several initiatives into law, manage grassroots advocacy campaigns to protect funding for community-based services and supports, and represented IARF on many broad-based coalition efforts. Josh currently serves on the board of directors of the American Network of Community Options and Resources, where he is also chair of the State Association Executives Committee and co-chair of the Government Relations Advisory Committee. And the last but not least, we believe Kimberly will be joining us. Kimberly Mercer-Schleider is the executive director of the Illinois Council on Developmental Disabilities. Prior to taking this role with the council, Kimberly worked as a transition manager for the country's third largest school district, Chicago Public Schools, working to educate families and school administrators on best practice when bridging the gap between secondary and post-secondary settings. Prior to both of these roles, Kimberly started out as a teacher, but most importantly, a family member of a person with IDD. Kimberly has a passion for supporting systems change that results in individuals with disabilities having access to all facets of a full, engaged life on their terms. Kimberly has a background in special education, creating integrated housing models, person-centered planning, and large system administration. Kimberly holds degrees in special education and nonprofit business management. So please join me in welcoming our speakers. Go ahead and get started with Tonya. We will have a question and answering session after the presentation. So please hold your questions to the end and we'll be coming around with questions.
Hi, thank you. I'm going to try to not blow you out of the room so I can get a little loud. So I will try to remember that. So a lot of my slides are just informational around the Division of Developmental Disabilities. Sometimes a lot of people don't know a lot about what we do and who we serve. So we appreciate you all inviting me to be part of the conversation. And let's see if I can actually make it move, and it's not going to move for me. Wait. Am I doing something wrong? Nope. Not working. Never mind. All right. I just touched it. Oh, okay. All right, so our first screen really covers a breakdown of all the individuals across Illinois that we serve. Our largest population is at-home adults. That is getting close to 12,000 individuals. We've served close to 11,000 individuals in SILA, which is our community independent living arrangements, homes in your neighborhoods that provide staffing for individuals with developmental disabilities. ICS, intermediate care facilities, we are at around 3,300 there. State operated developmental centers, which are our SODCs, some people refer to them as institutions. And we have about 1,600 individuals living there. Our day programs are around 1,250. Children's home-based is almost at 1,000. MCDDs, which are our medically complex, are a little over 800. CLS at 288 and children's residentials at 120. So if you noticed our graph for the budget, we have been, quite blessed over the past several years with an increase in our budget. So as you can see, it's steadily climbing up. The SODC line is fairly flat. They work on a per diem system. And then of course our DD community is continuing to grow. Proposed budget highlights, we have 100 million to support mid-year implementation of the $2.50 hour wage increase for our DSPs. And that's been a huge benefit in recruiting staff. Preserves $2 million in statewide services for community group home DSPs. 30 million for 630 new adult PUNS placements in FY24 and 630 more placements in FY25. And I'll get more information on the PUNS list. 11.7 million proposed for a 3.2% increase in home-based program liability related to the Social Security insurance increase, and then 4 million to annualize the cost of 500 children on the PUNS selection. We've had increases for ISCs to support their case management work, independent service coordination. If you aren't aware of what they do, is they're really our case managers. They find individual services to support, their hopes, dreams, and goals. We have a housing navigator from a pilot to an actual permanent role. Our housing navigators, again, assist individuals in finding where they want to live. Like, is that an apartment? Is that a home? So on and so forth. Okay, good. PUNS selection. The PUNS list is the list of children and adults with IDD who want home and community-based services now or in the future. It's an interesting caveat. Once you get picked off the PUNS list and you are determined to meet criteria, that's kind of like your, Willy Wonka golden ticket. Right? So you don't have to use it today. You can use it next year. It's not going to expire. Individuals access services by being selected off the PUNS list unless they go into crisis, and then it's a different process there. Since 2012, 14,909 children and adults have been selected for waiver services from PUNS, 1,064 kids in 2022 and 2023. So we're very excited about that, being able to assist people earlier on in their lives. And then wait time for adult services is around 50 months now. And again, that's significantly shorter than it used to be. In FY25, we anticipate adding at least another 630 people to the adults with DD waiver by selected almost 1,200 individuals off the PUNS. So our continued goal is investing in the community. And since its 2020 publication, Illinois has been implementing these recommendations over a multi-year period. The study's authors recognize the pressures faced by the state in these recommendations, thus leading to a 5-year phase-in of the recommendations of $792 million increase. With the FY25 proposed budget, the state will have invested almost $500 million in furtherance of the Guidehouse recommended increases. And this just kind of gives you a breakdown of what those increases have looked like over time. Then wage investment, again, just giving you some ideas of where we are trending towards the positive. So direct service professionals were increased to $22.08 an hour in most populous regions such as Chicago, Cook County, and $19.50 everywhere else in the state. Again, that's just kind of a going rate average. Not everybody is at $19.50. This represents a 50% increase in wage reimbursement rates over a 4-year time span. So Division of Developmental Disabilities, this graph we reach out to some states just to get what their average DSP hourly wage was. We received recently Missouri's, and their average is about $16.30 an hour across the river. So kind of to look broadly at what everybody else is doing. Support for providers. So we have 12.5 million for staff retention for about 160 CDSs and supported employment eligible organizations. We refreshed our new provider orientation and resulted in moving from 1 new solo provider in FY23 to 11 so far in FY24. We've created a new technical assistance program and hired staff for it. And then the new $18,000 incentive to open new 3-person single bedrooms for licensed 24-hour solos. And that's the average 3-bedroom bathhouse in any neighborhoods that you come across. Growing focus is increased funding for stabilization homes, short-term, long-term, and transition. Currently, we support 32 people and working to expand to an additional 40. What that looks like is if someone is in crisis, the short-term is about a 90 to 120 day stabilization. Long-term, when we develop those, will be around 1 to 2 years. And then transition homes are for individuals that may be struggling to find a provider that's able to meet their needs. And this would give them a good opportunity to show how well they're doing in the community with those supports. Support service teams, SST teams, efforts to expand training and support currently support 800 people on a rolling basis. So our SST teams are behavior analysts. They are going out and supporting individuals that live in the community with more of an enhanced behavioral focus. Updated nursing service calculations, which will increase payments for nurses providing services to individuals with complex medical needs, because Illinois, again, we have to focus on behavioral needs and medical needs in order to provide support for everyone that we serve. $5 million in funding made available for supporting providers to train frontline staff in de-escalation trainings, and we're currently in the process of trying to roll that out. And then funding for a contract for provider mentor for at least 2 years. And then thanks to my team, they're always happy to throw all kinds of stuff out to make sure everybody knows what they're doing. And they do a stellar job, and they should get tons and tons of credit. So Housing Navigator pilot made permanent as of December 31st. 68 people have moved out, 337 referred to the navigation system, and 296 enrolled. There's 261 enrolled in statewide referral network and 100+ housing owner outreach. So this Housing Navigator, I kind of see it as housingmatch.com, right? Like, what are you looking for? Where do you want to live? And that's what they help you do. Money Follows the Person program. We are still working diligently with HFS as a goal to bring that in for DD. And then respite services, respite grants supported over 7,000 individuals in the first 2 quarters of FY24 and have seen 3,500+ individuals being supported. The FY24 budget for respite services includes in-home residential, voucher and group, and then Illinois Lifespan Respite is a $1.3 million 5-year grant through 2026. So we were asked about challenges and changes for the division of DD. So our population varies around about, I'd say 80% dually diagnosed individuals who have mental illness as well as developmental disabilities, as well as also to include intellectual disabilities. And so our challenges are individuals with IDD are more likely to develop major mental illness, and individuals with IDD may different manifestations for mental illness. So the textbook definitions of what bipolar looks like in someone that doesn't have a developmental or intellectual disability does not meet the standard definition for the individuals that we serve. And we struggle in that area, especially with providers in the community providing service. A lot of our providers don't come with experience in that dual realm. And so sometimes it's said that, I'm going to use Josh for an example. Josh has significant behavioral challenges, right? And he does. But are those a manifestation of his mental illness, or are they truly like a learned behavior? And we really need to emphasize education to be able to separate those two, to get the person the treatment that they need. Does he need a psychotropic med, or really does he need a behavior management program? Changes needed, as said, for inclusivity and accessibility is diagnostic and overshadowing is common and barrier to appropriate psychiatric treatment and supports. There is little training regarding dually diagnosed IDD and MI individuals in medical schools, psychiatric residency programs, and other professional training programs. We were just talking earlier, I was I consider myself very blessed to come up through a system under 2 psychiatrists that had been in the facilities a long time and had specialized in working with people with dual diagnosis. We really need to expand people's exposure so that individuals get the treatment that they need. And then training for both professionals and direct care staff regarding the manifestations of mental illness in individuals with IDD is extremely important for those that we serve. There you go. I think we're doing questions at the end. I'll hand it up.
That's impossible to follow. So, is it like automatically appointed, or do we need to? Okay, so I can ramble for a second.
Yes.
So yeah, who could complain after all that? And actually, one of the things I appreciate about seeing the presentation there is, in my space with the organizations I represent, is we often sometimes unintentionally lose track of some things, and one of them is that the Pritzker administration, unfortunately, it has to make up for the sins of the past, which is years and years and years of previous administrations with a lack of investment in our service array. And when you do a little bit of good, that creates expectations. And so with all of the amazing leadership that the administration has shown and the investments that the General Assembly has made in disability services, with that comes increased expectations. And I think we suffer from that a little bit, but do I want to take a break then so we can do the official, or did we already, am I just making this awkward by her trying to sit down without drawing attention to the fact that,
Yes.
Director of the Council on Developmental Disabilities and Mercer-Schleider, they did do your bio, we learned everything about you.
Wonderful.
And I'm going to go ahead and do what I'm supposed to do.
Do it.
And then, okay, all right. So folks, thank you for having me. Are we all 708 boards here? Are we 377s?
Yeah.
Okay, so, all right, fantastic. From my standpoint, I just want to thank each and every one of you for your volunteer capacity and your efforts, whether you were part of creating your boards or you joined in inheriting them. It's amazing that there are local communities and counties that are willing to come forward, recognizing the challenges within their communities and to try to identify funding mechanisms to help locally. You guys are a treasure. I know with organizations that you fund directly, it's amazing. And my hope is that they'll continue to grow, and that, you know, through the work of ACMHAI, I know they're active in trying to eliminate barriers to further grow, expand 708 boards and other types of boards. There's a piece of legislation I know that Jody and I have had some communication about that we absolutely support, and hope that you know, any further barriers and updates that are necessary can go forward. So I'm with IRF. I've spent my entire professional career with this organization, and because I've never left, eventually they knew they had to make me the CEO. I don't know if that's what happened with some of you, but that's what happened with me. And so I do have the honor of representing predominantly not-for-profit developmental disability and mental health providers in the state of Illinois. Our association, did you just pound it and it worked?
Yep.
Okay, all right, fantastic. We were incorporated in 75, which means we've got a birthday coming up next year that I need to aggressively start planning for. But where we started was way back in the day, prior to, I think it was the Edgar administration. there were at least 3 separate departments that were combined in DHS, and one of them then in the 70s was a Department of Vocational Services, and these were vocational providers back in the 70s in which they were running out of money from the state of Illinois to pay for the services they were providing. So their organizing principle was to come together as an advocacy organization to advocate for increased funding for disability services in Illinois. And that's pretty much what I do today, 50 years later, in terms of the sole reason for being is to advocate for increased resources from the state. Because while it's not the same in other states, certainly we know that there are states in which counties have an increased relationship with funders, the state and federal government. You know, we pretty much have a centrally ran, centrally funded disability and mental health system in the state of Illinois. We've evolved over time. We started out as vocational providers to grow into in the 80s when they started waiver programs to be waiver providers, intermediate care facility providers, but also mental health providers. I found with a lot of my members that their service array grew organically to try to meet the needs in the communities when we were a grant funded system. So it's not uncommon for a lot of IRF members to not just do DD services, but they may operate a community mental health center. We're seeing increasing numbers of behavioral health clinics because of services that can be reimbursed through that mechanism. So that's kind of us, you know, we're kind of BD and mental health. We're small. We've got 5 staff. I have 3 vice presidents and a director of education and member services. This would be a much better discussion if our vice president of IDD policy was here, because she knows all the things, but she's in Edwardsville and I couldn't make her come up for this as much as I tried. So we'll try to make do with me being here in that respect. I won't read through these. Every organization's got a mission and vision, right? They're all very good and important words that we all live by. We have those too, but you know, this is essentially ours and I won't read them. We want to do good things for people is really what it comes down to the best of our ability based on how we're reimbursed. So I'll kind of skip over that. Some of the things I am going to talk about, and the good news is that the director referenced many of them. And I would be remiss if I didn't say it's been an incredibly good ride, despite our consistent issues and things that we still think need to be done in the disability system. It's been night and day under the administration and recent general assemblies from the previous administrations. There was a recognized need by the governor and the department the director works with of an investment in our social safety net because we are a state in which we have an active consent decree in place. But a recognition that in order to improve Illinois' standing, in order to expand access to services, investments need to be made. And the director talked about some of those and some of them I'll reiterate. The things that we try to do to provide training and education for our members, like many groups do, advocacy being our #1 priority, but also to try to work with the director and her staff, the General Assembly, other offices on policy that impact providers as organizations. The director mentioned a training that we're very excited about, this de-escalation training. I didn't know there was $5 million attached to it. That increases my expectations. So I'm very excited about that because that is a real need that's been data documented by some of the work that the division has done. One of our ways of trying to assist in that is to try to supplement or provide some of that training that maybe can't be met by other organizations of the state. So we have piloted some ABA trainings for qualified intellectual disability professionals in the state of Illinois last year that we're going to try to continue probably in 2026. One of the things that we started 2 years ago is frontline supervisors in residential settings primarily are what make or break the ability of staff to effectively serve adults with developmental disabilities. So we started a partnership with the National Alliance on Direct Support Professionals to train up frontline supervisors on basically how to be supervisors, how to have trauma-informed leadership. We've done that. We've had about 500 individuals go through that in the last 2 years, and we're going to continue to involve that this year, because if you've got good bosses, you tend to retain your staff. So one of the things we're trying to address, besides just asking for money constantly, is non-state rate ways of trying to improve recruitment and retention. One of the things that I'll talk about later, but it is very important to our organization, is community-based employment for adults with developmental disabilities. This is sort of going to have to be, if it's ever going to be successful in our country, that we can fight against the employment numbers for persons with developmental disabilities and rise them above where we're at, is it's going to be an all hands on thing. It's going to involve service providers It's going to involve natural supports, but it's also going to need to involve private businesses recognizing the true value of hiring adults with developmental disabilities and not just have to be incentivized to do it. So we are in the third year of a technical assistance Did you guys have acronym hell? Or is it just me? You guys deal with a lot of acronyms
Yeah.
constantly? Okay, all right. So I don't feel bad then that I'm constantly throwing out new acronyms. Okay. All right, but NEON.
We have to report to our board.
Okay, fantastic.
There.
Okay. NEON, I can't think of the acronym, but it's an employment-related technical assistance grant that we get through a national membership. We're in our third year, and that's to try to provide technical assistance to community day service providers on starting up and growing their community integrated employment services in all parts of the state, not just in our urban areas, but our rural as well. In terms of advocacy, we got a huge win last year, and I say we, all of us, because the General Assembly approved a $2.50 hour increase to the direct support professional wage rate. This and the entire time I've been in the various roles with IRF, it's all been about staff. And I say that because quality staff at the point of interaction determine success of individuals to live and thrive in their communities. And so our goal, because there has been a rate study that has been approved through the Director's Division, is to try to ensure that the rates of payment to providers for DSPs is at least 150% of the statewide or regional minimum wage. So kudos to the director, to the administration, to the General Assembly for the numbers that she put up. We're about 139% right now. Our goal is to try to get 150% in the next state budget. I don't think we're going to get there. I don't think we're going to get there, but we're going to do our best to try to get there. But that's sort of like where we want to be. And we have data that supports that. We, due to this most recent investment, we're consistently hearing from providers talking about their vacancy rates dropping, their retentions improving. So we know that there's a direct correlation between wages and benefits to the ability to recruit and retain staff. And we don't want to lose ground on that. We want to continue to do that because we believe if we can grow our staff, we can expand services. Another win and something you guys are familiar with, the administration and including in the substantive initiatives that the governor has been putting forward this year in the behavioral health space. There's been increases recently in Medicaid funded psychiatric services and behavioral health services rather. There was a 30 million increase in the budget last year. We're looking to try to get another 12 million, give or take a few million there in the final budget this year, targeted specifically to behavioral health Medicaid psychiatric services rates. And in terms of some on the policy space, this was a multi-organizational effort to stand up this community behavioral health professional loan repayment program that got stood up a couple of years ago. The immediately following year, we expanded and increased the investments into that loan repayment program. I think it's been a pretty strong success due to the number of applications, and I anticipate that that's going to be an area we'll continue to look to grow to try to get professionals into behavioral health and keep them working here in Illinois. I was just on a call about this next one. We haven't got it figured out yet, but with the explosive growth of telemedicine during the pandemic, there's an opportunity, we think, to tailor a telemedicine service to adults with developmental disabilities to prevent what is all too often occurrence, which is adults with DD going to the emergency room for non-emergent conditions because providers have liability concerns. And because we don't have nurses embedded for these types of healthcare needs in our group home programs. So that's something that we're looking at doing. I'm not going to completely steal this because it was your guys' initiative to expand short-term stabilization homes and long-term stabilization home models, but it is something that we've pushed before. So I added it to our slide deck. And I think what that is that reflects there's different needs out there in the community and that some adults with developmental disabilities due to comorbid medical or behavioral conditions sometimes need to de-escalate in a space where they can have a med wash, whatever situation may need to be done in order to stabilize them. And so we've had a limited number of short-term stabilization homes in Illinois over the years, and due to leadership of the division, that number has expanded. And we're looking forward to some long-term stabilization models coming on. So, and I'll CCBHC, this is a model that was started by the National Council on Mental Wellbeing many years ago. Illinois is a latecomer to this, but essentially it is a model of behavioral health service that includes several required on-type and services within the community behavioral health clinic. It's a cost-based model, which if you're a provider, you love to hear that. Your costs are being reimbursed. And so we're kind of behind the eight ball on that. We have several that have been stood up in Illinois. Illinois just, I think, completed sending in a demonstration grant proposal to SAMHSA, and we're hoping we're going to get approval on that. But the state that you came from, Missouri, was really leading the nation on that. They have several of these models in that state as well as others, and so we're hoping that this model really takes off here in Illinois. Yeah, you guys can all see that, right? Can you read every word in the back? This is our pretty document that tells the world what we want to accomplish this year. And I'll just boil it down by saying we're continuing to want to try to get our rate study funded. We were hoping to get this thing funded when it was unleashed in 2020. We were naive in thinking that we could get it funded because the initial outlay of fully funding the rate study was an immediate increase of about $329 million to disability services. The division and the department came back and said, we have a different timeline for this, and we recognize that. But to the credit of the administration and General Assembly, many of the priorities in that rate study have been either fully or partially funded. That we're trying to get through. One of them just happens to be the most important. But we're trying to see that rate study funded. There are some aging technologies, regrettably, that the director and her team have to deal with. Older than anybody in this room, practically. And I didn't look at anybody in particular. Don, I didn't look at you. But one of our priorities is and this is something that's unique, is for at least an organization like us that is fighting for non-operational state funded services or things with the state. It's always, how can we get more money? How can we improve policy for the community? We recognize this is an issue for the department, that their computer systems or software need to be updated and replaced. And whatever we can do to help make that happen, we recognize that that's going to improvements on services and supports in the community as well. And then just some additional things out there, continue to provide education and training as appropriate and as needed. We want to see community integrated employment in various models that grow. We want to help our members grow that. A big thing that we want to see accomplished this year, and I know it's important to both of the directors on either side of me, and that is to finally bring Illinois forward and not pay sub-minimum wages to adults with developmental disabilities. I think it's an idea that's long past and needed to come about here in Illinois, and there's a framework to do that. We just need to get it over the hill. And so we would like to see that accomplished. Beyond that, on some policy sides, continue to try to get the rate study funded, see advancements in something that is, I think, had the potential to be a game changer in Illinois, and that's an 1115 demonstration waiver that HFS has been working on. The prospects of maybe somehow paying for things like housing in some form or another, I think will be a game changer. And I know someone to my left here who's much more informed on these things than I am because of the work that she's done can talk about that. And I'm going to go off target here because I want to make sure that Kim has all the time in the world to speak. And we'll just summarize by saying, from my standpoint, we've wanted to get this rate study funded and we're going to get there. But what we recognize in the community is that we're rapidly approaching a tipping point informed by parents, individuals, and families. And that is the expectations that some of you may have had for your siblings and children are not the expectations that younger generations of families have. Wildly much more reasonable, rational, higher expectations. Our service array has changed dramatically since the 50s. And since some were told that the best thing for your child is to put them in an institution so that they can be cared for in a medical model. We're well past that, but our service models haven't necessarily caught up to the expectations that families have. There was a slide that the director had up earlier that showed the breakdown between adults in community group homes and adults in home-based. We haven't really necessarily mined that data as much as we probably could as a field, but I think we would learn a lot of interesting things about individuals that are choosing to go into home-based versus other types of models like residential services. And one of those being, I want different things. My daughter, my son, myself, we want different things that the state's not currently paying for. Now, at the end of the day, that could change over time. I mean, the SILA model is absolutely was created with the best intentions in the 80s, and that model has evolved a little bit over time to have some more independence. And it is something that can be extremely helpful for aging adults too, I think. But one of the things that I think is recognized is that we need to have a relook at our service array, look at best practices in other states, have a true coming to Jesus moments with our funders, our regulators, with our families, with our providers, and really identify and outlay what does the service array of our future look like. And so in terms of what my goals are at this point in time is to get the rate study funded, to have funding adequacy in our service array so that providers can, one, innovate locally, but they still have the opportunity until I'm fired, to work with the amazing individual to my left and to my right on ways that we can evolve the service array in the future. Okay.
I do, I have this.
I can.
Oh, that's so nice, thank you. Yeah, let's switch these real quick. Those are my purse. Okay. Thank you. Gosh. Why are there two? The problem. I have it, if you don't mind. Thank you.
72 phones.
And then are we connected to the internet as well with this computer? Yes, awesome. I want to show a little bit of the website too. Great. Hi, everybody.
She's coming high tech.
Hello. I'm Kim Mercer-Schleider. I'm the director of the Illinois Council on Developmental Disabilities. I'm excited to be here. I will go through sort of our role in state government here in a moment, but one thing that we have in common with all of you is that we fund projects often. We award grants, and I just want to, one of the big things I want to walk away with today, and I'm going to say it at the beginning and I'll say it at the end as well, is that I did bring a couple copies of our annual report, but I also have sort of a map based on legislative district as to where our projects are in the state of Illinois, and would love for you all to be aware of some of the grant funded projects that we have that are probably out doing hopefully some kind of amazing work where you are. And I think I really wanted to, you heard that from me first, and I'll repeat it again too, because I think that's one of the unique features of the work that the council does in government. And that also, I think, has a direct correlation with the work that you do as well. So I'm happy to be here. I'm gonna, okay. So I didn't know where this was gonna go. And so I think I really kind of wanted to know where you wanted to take this conversation. But I think that we would have some time for questions at the end. And so I'll just tell you a little bit about what we do and what our priorities are. And then we can go from there. So, that looks great. Sorry, I was a little messed up there on the bottom. But anyway, this is the council. This is the Illinois Council on Developmental Disabilities. I answer to a board of 29 members, and 19 of those members are people with developmental disabilities or their families, and they're governor appointed. We also have a direct interface with state agencies as well that are mandated members of our council. And so we have quarterly day-long meetings, and those are really the interface of people that receive services that want the system to be better with the leaders that are in charge of making the system better and listening to service recipients. And so it's really sort of that meeting is what the council brings. And we represent individual voice. And one of the most important pieces, and unfortunately I wasn't able to bring a council member with me today, but we try to ensure that people with lived experience are at the seat of every table. And we work really hard to do that in a lot of different ways. So I can tell you a little bit more about that as well. Councils, we're tiny. That's a little bit of my org chart, but we have 9 employees currently. So we're kind of a teeny tiny state agency, but we are a standalone state agency. And then of that group, part of us are focused on program and our projects, and then the other half, we have a fiscal entity as well. The reason why AD councils exist is because of a federal law called the Developmental Disabilities Bill of Rights Act. And that is a federal law that puts a DD council in every state and territory. So there's one of me, there's one of us in every state and territory in the country. In addition to that, the same bill authorized a protection and advocacy unit for developmental disabilities, which in Illinois is called Equip for Equality, which I'm sure all of you are familiar with that. And then it also established or authorized a university center for research excellence on developmental disability capacity and professional development. In Illinois, that's the University of Illinois Chicago Department on Health and Human Development. Disability, health and human development. And so the three of us, in some ways, are sisters. We're funded from the same federal source. Of the three sisters, we're the only one that's embedded in government, which is an interesting place to be, because we find ourselves often sort of advocating and supporting and partnering from the inside out. A large part of our work is I call it a nosy neighbor, in that we are trying to always partner with our colleagues within government that can kind of help, bring about changes in perspective while things are still sort of internal and we're trying to move things out. And it allows a really cool vantage point for partnership. The other interesting thing about us, though, is that we have our own authorization and our own spending authority because we receive almost 100% federal funds. All of our funds come from the Administration for Community Living, which is in the Health and Human Services umbrella at the federal level. And so we use that authorization, and that it gives a little bit of independence, because we always do our very, very best work in partnership. And we've had a lot of really great successes within the last few years, absolutely. But then there's also sometimes where you might not always agree, right? And we need to be able to tell our governor's office or our partners within the other agencies that, okay, maybe this one isn't the right move, or maybe we do need to. That independence allows us to do that. And so it's a unique sort of unicorn state agency, so 100% federally funded, really close, almost 100% federally funded, with some authorizations that not all agencies have. So it's an interesting sort of place to be. But we really try to take a look at what's wrong with the system and then try to figure out how to fix it. And the Developmental Disabilities Act essentially and this is the old wives' tale, and I don't know how much of this is true, but back in the time of the Developmental Disabilities Act authorization, the rumor is Senator Ted Kennedy was in the basement of a bar in Washington, D.C. and basically said, our states aren't going to do enough to move our systems forward in a person-centered, community-based way unless we embed some structures in our states that are going to help continue to move forward and continue to advise it. And so that's kind of where some of the impetus of the Developmental Disabilities Bill of Rights Act started. Now, don't quote me of whether it really was a bar in a basement in Washington, D.C., but I did hear that that's what it was. But essentially, knowing that we need something that's going to be continuously sort of stabilizing or ensuring that progress is being made. So we take that role really seriously. We are rooted in the belief that all people with developmental disabilities can live and thrive in the community with the right mix of supports. We think that institutional care is outdated and it's time for Illinois to move to a more individualized approach for long-term housing and home community-based services. We firmly believe that with the right supports and the right structure and the right intent, that everybody with the developmental disability can be employed if they'd like to be, or can have another option for a different kind of other meaningful day as needed. And I think we're always with the vision and the intent that everybody should have the opportunity to live a life on their terms, where they want to live, who they want to live with, just like the rest of us. And so we're kind of constantly pushing to figure out how to make that more of a reality for folks. Our projects, our federal authorization wants us to sort of look at the most pressing issues for people and then react to them. And then based on that, we create a 5-year plan that we have to send up to the Administration for Community Living and get approval for us to enact. And so every 5 years, we have to go through the strategic planning process that includes as many stakeholders as we possibly can to figure out, okay, what should the priorities be for the council for this next 5 years. Our state plan is on our website. And you can kind of see some of the things that we have our fingers in there. I also bought copies of our annual report that kind of get into sort of the specific projects that we have going on. There's a lot of them. I think we have 22 currently active open grants running around across the state. and doing really cool things. So I will get into just what a couple of those are as a couple of examples, but I think, again, we look at the system, we try to figure out how to fix it. One of the big pieces is, again, taking our federal funds and pushing them out in grants. We talked about that, but then the other part is playing sort of that policy advisor, kind of trying to stay abreast of what changes are happening within healthcare and family services, and how does that come over and impact our friends in the Department of Human Services, BDD, and how are we making sure everybody's talking to each other, and then if we do this, it'll impact Division of Rehab in this way, and then if this happens, it might upset, or it might, you know, impact services on this other side, and so we're kind of constantly looking at the system. One of the things that we've really delved into and have been successful at much more in the last couple of years has been one of our legislative friends called it legicating, but we are in the State House educating legislators all the time. And we try to be an open resource for folks, especially for those that are asked to make really big decisions about disabilities and disability policy that might not know exactly the perspective of what it feels like as a family member or an individual with disability and how this policy could impact them. And so we're constantly working to bring individuals' experience and individuals' voice to the table so that legislators can hear directly from the people that are receiving the services, or directly from the people that their policies will impact. 5-year state plan, we talked about that. So you can't really see our areas of emphasis because this slide is really stinky, and that is the background is light, but we got our fingers in all of it. Recreation, transportation, advocacy, early childhood, early intervention, a lot of work being done there. Employment, childcare, community supports, health, housing, quality assurance. It's a large range. It's essentially somebody's full life. All the different places and parts that you know, touch an individual, we can work in it, or we have authorization to take it on. We're not just focused on adults. We spend a ton of time in adult services, but it's not just we've got projects even ranging from currently a project in Chicago with Lurie Children's, where we're working on bringing in services to families with babies in a NICU that have a developmental disability at the onset, and how can it bringing in services to moms while their babies are still in the hospital, is that going to keep them able to, is that going to increase their chances that they'll be able to access services once the baby's out of the hospital? And so we are from the very beginning all the way now to what is a meaningful life for somebody with a developmental disability that is in their 60s and does not want to go to work anymore, and how do we help make sure that there's a whole continuum of opportunities and people can get a chance to realize, you know, a full life and take a rest, and what's retirement look like, and why do we keep doing the same things over and over again, and how do we look at that? So we got our fingers in all of it. We did want to highlight just a couple projects that we have, and I think let me go to about the babies. Couple. So one of the projects that we've most recently had a lot of success with, that we're getting ready to kick off again in a different way, is a partnership with the National Disability Institute, where we asked them to come in and support us in creating a curriculum that was specific to the state of Illinois, which we have all of these resources. That's the other piece too. Once we use our federal dollars to create a project, it's free, it's out there, it's ready for everybody from that point on. And so we have a huge resource library. And we partnered with National Disability Institute to create financial wellness training for people with developmental disabilities. We've had a lot of awesome successes with that, to the point where folks that weren't ever saving before are now saving. There's an individual that we know of that bought a car as a result of learning how to increase his credit score, which is a really awesome thing. And it's not, unfortunately, something that we take for granted when we think about all of the opportunity of financial wellness. We don't always apply that here. And I think that that's a mistake. In particular, if we're really now focusing on increasing people's wages and getting people more employment, why aren't we also then focusing on what to do with that paycheck once you get it? And so that was a big inspiration for launching this project and this initiative. We trained over 15,000 people across the state of Illinois in this financial wellness curriculum, which is awesome. We are also working really hard to get providers ready to provide customized employment. We're working on legislation currently that will expand a pilot project that we're going to change the name from pilot to demonstration if this bill passes, but allow an additional 5 years for the Division of Rehab to create and implement a larger service delivery impact for customized employment and specific customized employment, which is different than supported employment, which is a whole other day-long presentation as to why. But customized employment essentially is the employment service that is intended and designed for people with the most significant disabilities. And it takes a look at employment sites and figures out, you know, jobs that people can do that might not be necessarily a part of a business's current repertoire, but how can we come in to your business, see what kind of services you provide and need, and then how can we carve out something for somebody with a disability? There's an entire curriculum and training and pieces that go with that can be something that can be, and which is in a small degree, we're trying to make it more a funded service by the Division of Rehab Services so that providers can get a contract with the Division of Rehab Services, start providing customized employment in their area, and then hopefully get more people jobs. But there's a lot that goes into that, but we're currently up to our eyeballs with that as well, and providing training to people that work at provider agencies that might be interested in providing customized employment. And so one of the other big pieces that we do, aside from our projects, is policy advising, as well as sort of education of people as to why our system is the way it is. And then how do we fix it? And we think that that's a really important, we want to ensure that we're equipping individuals with developmental disabilities and their families to be the ones that are the best advocates. Josh, me, Tom, we get paid all day to focus in on this. You get paid? Yeah, all right. I get paid. Josh volunteers. So we get paid all day to focus on this. All day, every day. And what we're trying to do is equip individuals that don't get paid to do this all day, but live it. With how can we take all of that lived experience and then share it in a way that's going to be impactful and change policy. So we do that in several different ways. One of the pieces that is really exciting that I would love to have anybody that's interested in getting on our listserv or to try to see how maybe you can bring some of the resources that we have for families and individuals to the folks that are in your specific parts of the state. I'll make sure that we are connected before we leave so that you can get in touch. One of the big pieces that we offer is a class that's called Partners in Policy Making, which is a big undertaking for an individual or their family. But to me, it's almost like a master's degree level graduation. When you're done with this intensive program, it takes about 6 months to complete. You should be fully steeped in why our system is the way that it is. What are some ways that I want to change it? How can I build an initiative around that? And now how can I go and talk to legislators to try to get some things done? We've graduated over 75 Partners in Policy Making graduates through our project who have gone on to do amazing things. They join boards. They get into leadership positions at different entities. They come with us to the Capitol and work with us in talking to their legislators and create these relationships. They make big changes. We have one of our Partners in Policy Making grad, I just talked to her a week or so ago, that has weaseled her way in the most amazing way into the Archdiocese of Chicago, which is now taking a much broader approach now that she's got everybody's attention into how to make faith-based settings more accessible to people with developmental disabilities and include people with developmental disabilities in faith settings. So that's just one example. Our graduates go on to do really amazing things. And so those are a continuous series of classes that we're running. If you know advocates in your area that would be interested in kind of getting that kind of training, it's a hugely impactful project that we have. But we also fund the Illinois Self-Advocacy Alliance, which is a training and development program for people with developmental disabilities to help them use their voice. And some of them are starting with learning how to decide what they want for breakfast that morning and tell somebody about it, all the way to dictating and being in charge of their own person-centered plans and being able to tell their service providers how they want things done and how they want to live their life. So that's a really cool program that we have as well. And then there was another, there's all kinds. And then another coalition that we also helped to start, which again is another way to amplify individual voice, is a group called the Going Home Coalition, which hopefully if we get them, that's awesome. The Going Home Coalition, which if you haven't heard from them, they will come to you and tell you everything you need to know. This is a group of people that we funded to, it's predominantly individuals with developmental disabilities who lived in institutions at one point that no longer live in institutions and really want changes in that regard to make sure that other people don't have the same experiences that they had while they were institutionalized. And so with that, they come out and provide educational speeches. They meet on a regular basis too. They definitely are knocking on the door of our Division of Developmental Disabilities and other leaders in our governor's office, et cetera, just to keep the advocacy alive and going around ensuring that we're making really strong community-based policy decisions for people so that more people have access to life in the community. So that's kind of how we're investing in individual voice. It's quite a bit and it takes a lot. I think I've been in this position about 8 years, and I want to say over the last couple of years, we've really started to see the fruits of our labor of all of that investment of educating people on how to use their voice. We're getting feedback from the State House, we're getting feedback from our colleagues that like, whoa, there's new voices that are out here now, which is really exciting. So any ways that any of you might be interested in sort of, you know, increasing the voices of the folks that are like live in the area or receive benefit from what you provide, we're more than happy to talk about how we can partner on some of those things. I think I'm gonna stop talking now. But I wanted to highlight that we have a series of position statements. If you're wondering where we stand on things, they're all on our website. We can share those as well. But I want to do one more thing real quick before I'm done. And I need a web browser real quick. And I don't want to you know. But if you want to go to open up a web browser to 377cares.org. Because we're so excited about what your boards can do and the impacts that you have in your community. We had partnered with Roy Baker, who is now the CEO of Agency for Individual Development, AID. And we partnered on projects that made this. The 377 Cares Toolkit is a series of, there's curriculum, process, coalition building, frequently asked questions, a ton of resources. Essentially, we are trying to equip communities in the state of Illinois that don't have a 377 or a 708 board, how to get them. And so we wrote a curriculum on it and we have it here. And so if anybody is ever, if you get questions about, you know, you're talking to other folks about the work that your boards do and they say, we don't have that and we want that, we wanted to provide a resource to them that would give the steps that they can take in order to get one in their community. Because when you look at the potential of impact that these boards can have on specific communities, in a lot of places, it is the difference between people getting served or not. It's the difference between people having what they need or having to go to live somewhere else to get what they need. And I think that there is so much more potential in the merger of the supports and services that all of you fund and provide with sort of a statewide strategy of where are we missing some of these boards. And so at one point, when, this is what's left of our project, we told you when we fund things with federal dollars, we make them free for everyone. So this is the resource part. When we first started this project, we were trying to hit the state. We're trying to get people recruited, trying to get them to understand what it is. And so then we can talk about how to get one in your community if you need one. And as this takes so much time, it takes a long time to get a ballot on a referendum in a community, and then you fail once, and then you gotta go back and do it again, and then you gotta go back and do it again. So this is like a really long game sort of intention, but one that I just want to make sure that you all knew that this resource existed. And if you ever talk to anybody else that's like, why aren't we doing this? At least maybe there's some information that you can get here that will help them figure out how to do this for themselves. We have a lot of priority areas, I think, coming up. If you were going to ask me what we are focusing on over the course of this next year, we are heavily involved in wanting to support the state's transition into banning 14C and providing meaningful, competitive, community integrated employment opportunities for people, or alternatively, you know, things that folks can do with their days that are as meaningful to them as what they were doing before. And we know that that's going to require a really big transition and a lot of intentional thought and planning. And we want to ensure that we do that in a way that leaves nobody behind. And so I know that that's going to be a major priority focus for us over the course of this next year. Josh alluded to it as well, and I can't go into it again, this is a whole other day. But we are passionately committed to continuing to figure out how we can get more people with developmental disabilities into supportive housing, permanent, affordable, supportive housing in the community. We're doing it in a couple of different ways. In one in particular is partnering with the Division of Developmental Disabilities on a housing navigation program, which I don't know if you mentioned it, but we don't need to get into that too much, but we're supporting that with technical assistance. The council is also funding transition funds for people with developmental disabilities who need to move, who want to move, that don't have the upfront cost of the moving trucks, those pieces that, you know, when you're somebody that receives some community-based services and you're moving to an apartment in the community, and or let's say you're moving from your family's home into the community or something like, or into an apartment, those moves are not funded in any way. And so we knew that we couldn't introduce a program around moving people without also providing the funding to help them move. And so we're embedded in that as well and supporting a lot of people. It's dating on homelessness with this program as well, which is like an incredible, it's an amazing program. So we're fully committed to that. But we're also in supporting this through supporting providers in knowing what it takes if you're ever interested in getting invested in a development in a large multi-unit building. How do you get the funding? How do you work with the Illinois Housing Development Authority to do that? Again, this is like another long game project. These development takes a really long time. But excited to say that we've seen some successes. We've had developers get awarded really large grants to build buildings from the ground up or to rehab older buildings that can be used multi-purpose. People with developmental disabilities, the aging population, veterans, low income, whatever it is, but these units are popping up. The federal government is supporting that, in addition to being able to have funds to rehab older buildings. And so we really think we don't start moving people into their own apartments, we're going to run out of housing. We have to start figuring out how to make this easier for people. And so we're definitely invested in there as well. And then the other frontier that we're looking at, that we know that we need to have some effort into, that we're trying to figure out how the best way to do it, is ensuring that those families that receive home-based funds are being supported and advocated for in a way that will give them some parity in all of these big investments and things that have been happening over the years. Our families that receive home-based and our parent caregivers need that attention too. And so we're kind of starting in the initial stages of figuring out how we can get into some reform of our home-based program, help more family caregivers, give people some more options, bolster them, because they're currently providing services to over half of our service delivery system, and we need those individuals and families really, really well bolstered and supported. So we're kind of looking at how to crack that nut, and that's a big one. In addition to trying to stay ahead of some federal initiatives that are coming down the pike and making sure that they land well and become system embedded changes. So money follows the person is one of those topics that we're really trying to make sure gets landed here in Illinois so that more people with disabilities can move from institutional care into the community that have it funded in a better way. So there's that. But then there's also opportunities within our level 15 demonstration waiver that we're working on, and just making sure that PD gets included in all those different places, because when you don't pay attention, sometimes they don't. And that's why you guys are here too, because your board wouldn't exist if you guys also didn't know that not everybody's getting served in the way that they need to, right? And that is what makes your work so valuable too. So I'm gonna stop talking, because that was a lot. But I'm excited to answer any questions.
Let's see how fast I can run.
All right, first question.
First, I would just like to say thank you, each of you, for all that you presented, and it's just so inspiring to hear the growth and opportunities and the advocacy that all of you have done to bring this system further where it should be. I think that those of us that have been around for a while, this is the most I've ever heard in terms of transformation of the DD system. So thank you. It was good to see number one with the I'll get the minimum wage increase being number one in Illinois, and the retention now with the workforce. Workforce in our area is still an issue, and probably like all of the other systems, we're all facing that. So we've been looking at that locally and looking at, we actually had a local federal grant to support some certification. So we were looking at the DSP certification, but we know that's on hold right now. Is there anyone can speak to where we're at with that, or where it's going, or how soon that might be coming about? Because we had funding, it's going to be gone in December, but we had a year of funding, a couple of years of funding to do, and it's going to be gone, but we still want to pursue that.
Is there just
So
one?
I don't know if this answers your question directly, because there are different ways of approaching certification. So a few things that stand out to me is there has been on the books in statute for some time now, a credentialing approach to DSPs with when we were working on it back in the day, the long-term approach being looking at states like New York and elsewhere to maybe try to figure out a way to tie reimbursement for its level of credentialing. This was kind of a brainchild of NADSP initially. They've made it a little less complex because credentialing is not an easy thing to do. So there's that on the books. And then what I would largely say is constituently driven programs have been legislated that are on hold right now to try to learn from other healthcare industries, which is to try to get workers earlier. Ohio had I think it's a tremendously successful model that they've expanded to their largest school district in Ohio. It's called C3PO, which is a Star Wars nerd. It's an amazing name, but essentially it is working potentially with high-risk youth in school districts to introduce them into direct care and to have a combination of traditional school-based curriculum, but also direct support professional training curriculum, so where they can earn credits. And by the time they graduate high school, depending on your state's requirement for DSP, you're good to go. You're trained up. And from my perspective, and I could have this wrong, I'll hand it over, but the division, I believe is in the process. They've RFP'd out to get feedback on what, various certification models might look like, but also maybe what various forms of DSP credential curriculum would look like. And you know, I think that is impacting the startup of some of these other initiatives, certainly the credentialing pilot here in Illinois, but certainly I think other entities that may want to work with local community colleges and local high schools to start up some of those initiatives, I think is a little bit subjected to, you know, when the division's coming forward on that. But I mean, I know that there is interest with providers and as you're talking about communities that want to stand up these programs, but I don't have any inside baseball on where it stands.
No insight, no. For the inside, information, what all Josh said was correct. We do have legislation, that says, about certification going into community colleges and high schools. And we are trying to work on what that would look like for Illinois, instead of having wide varieties of certifications going through, and it being piecemeal. So we are looking at that, but nothing to nail down at this minute. Oh, and I did want to say, Ms. Deborah asked earlier, DHS.DDD comments is our comment board for the division. We put lots of information out all the time in regards to a wide variety of stuff. So it's DHS.DDD comments at illinois.gov. So if you'd like to join, it's free.
I came up here to make it easier for you.
Oh,
To get to the second question. If you're ready for a section.
Thank you.
I have a question for you that might be like way too soon to ask. So first, I want to just appreciate y'all and I want to say hi to everyone. I'm Lynn. I'm the president of the state association here, and I'm very, very happy to have a DD focus at this meeting. And partly because I've spent 60 years yelling at everybody about DD services in Illinois, because I'm in a family that's had some generational impacts, and I could go on all day about the collateral impacts of our system, not just in Illinois, but nationally. But I think the most important one is the most cynical one, and that is DD stands as a really great example of what can happen to a system if almost no one cares. Like, this is how cruel we can be as a culture. So I'm really honored to have 3 people who have committed their careers to people with intellectual and developmental disabilities. And it's really great to see you and meet you. And it is also a small world. I've been talking to Barb Pritchard. Oh, so, right, like who doesn't know Barb Pritchard? So my question to you is about this, this federal, what was it? It's a Biden announcement on Monday that 80% of Medicaid home care would have to be direct service, but I am getting the feeling this is about nursing homes and not impacting HCBS, because I mean, it's a really great idea. And I also, you know, spent some time with Joe McBath, and he also pounds the table and gives some really great advice about how to lift up the DSP workforce. And I've been working on some of that nationally too. I think those are really great efforts. So I'm so glad y'all are aligned with those, but this would be really interesting and might have a really immediate poor impact if we're not ready for it. But I don't know if it even applies to DD waivers. Do you guys know about it? Yeah. Okay, yay.
So, okay, I will just say what you're referring to, and if I am wrong, please check. But what you're referring to are just within, like, it's a hot off the press that in the last like week or two drop of a new set of rules.
Monday.
Yeah, and I feel like it was, yeah. And so if anybody's unpacked it all and knows how it's gonna impact every part of our system by now, then you guys have worked faster than I have, because we've been sort of at least knowing what some of this new rule will contain, and we've had at least one meeting about it, and where we brought in some national experts to sort of like unpack and like, okay, how is this gonna impact? That's just one part. That is a hugely impactful set of new rules and requirements from Centers for Medicaid Services that we are all still kind of trying to wrap our head around. So that one specifically, I do believe does cover DD, but I can't, you want? So I am pretty sure. Yeah, so we're all like unpacking sort of like exactly who will be impacted. I know that there's a couple different parts to what you're saying. One of them is like a mandated, so how funds pass through to workers is a part of this. And then I also know that there were some capacity limit pieces that were put in and like new ways that nursing homes are going to have to operate as well, which are hugely impactful. And then, anyway, but and those are just two. It's a big one. And I think we're all still kind of like trying to figure out how exactly who it will impact and what those rules will look like.
Let's all stay in touch. It affects all of us too, so thank you.
Yeah.
There were 4 major rules that were dropped in a week that impact waiver, Medicaid, long-term care services, thousands of pages each. And so, yeah, it's rather unfortunate that they were delivered in such a way, but each of these things are going to have staggered impacts, dates, and they're going to be thoroughly reviewed by the lawyers and folks that these ladies work with, that I work with, and others. The access rule, she's correct, the Medicaid access rule, that's one small but important part, but there's a lot of cool things that are in that. I mean, so we have something called the Medicaid Advisory Council as a formal entity. Kim sits on that. I think the director may is de facto, I'm not sure. But that's been in existence in Illinois for some time. They're not going to require that those have beneficiaries that are enrolled active participants. The same access rule is requiring there to be some form of committee or feedback mechanism that includes direct support workers to be able to converse directly with the administration on things like rates. You know, that's part of it. What's interesting about this 80% thing is, and you know, there's the language of the rule itself, and then probably a few hundred pages before that, there's the justification by CMS and the decision that they made. Is it all comes down to what the definition of services are to determine whether or not something impacts something. So some of you are familiar with personal support workers in the aging and physical disability space. Illinois is a state where about, I think right now it's either 72 or 77% of all reimbursement to like aging organizations, that has to be passed through as direct compensation to those personal support workers, right? And when that initial rule was filed and we saw that 80% number, I'm like, this sounds very familiar. And if you follow politics about the influence of groups like SEIU and others, you know, things start to kind of come together. But our read right now of the rule itself and the impetus and the explanation is states are going to be states need to get more data, and the federal government needs to get more data about compensation mechanisms for developmental disability services. And what they did not do was apply this 80% pass-through requirement to habilitation services, which if you look under the federal definition of habilitative services, doesn't include things like group home stay services and stuff like that, the traditional things that our members provide. But that's not the case for like aging services and other waiver funded services, persons with physical disabilities, because those are more direct in-home services. Now, I think we're all going to have to unpack maybe what that means for home-based services and things like that. I think that's likely probably to be the case, but I won't be quoted. But one of the things we do know is where it doesn't apply. But I think as a state too, we need to have more data going, and I probably get in trouble with my members for saying that, but don't quote me. We may need more data from groups like ours going into the state government to say, this is how these, you know, wage rates or whatnot are invested. So, I mean, I think it's right in its approach, it's good in its approach. Raising the overtime exemption threshold, which is another rule, was good in its approach to try to increase compensation for hourly workers. But that's a big one that has to come with funding. I mean, in our space, we're not Medicare, Medicaid, private pay in disability services. It's Medicaid or whatever little GRF we can get from the state and the kind of services that you guys supplement locally. That's it. So when we have requirements like this, they need to come with funding.
Okay.
I just happened to be reading it yesterday, which is why.
Yeah, right, like you're
Right,
trying to
yeah,
finish
got
it
you
yet.
It's. I said, I was like, I was close my-
Yeah, no,
Yeah.
it is. Anyhow.
It's a lot.
Hi. My name is Jason, I'm from Winnebago County. In Winnebago County, our mental health board does not fund intellectual or developmental disability services, and we've kind of struck that this is what can happen to a system when people don't care. And so I guess my question is, For those of us who do care, but aren't in this, and who don't know all the acronyms you're talking about, and don't fund this, and maybe just because of the nature of what we're doing, we're not fully paying attention. How can we be honest?
Just throw it.
Yeah, I'll catch it.
Another good term.
Thank you, and I probably wouldn't catch it either, would be a disaster.
Yeah.
So I guess maybe one question is, if the board is not funding developmental disability services, is there some sort of policy or rule or thing that precludes it from doing so? Or is it just something that hasn't been looked at? Because I don't know, so that would be two pieces. It's either a lack of awareness of diversity and choices that the board is making and what they could fund, or is it some sort of internal policy or a piece like that? But what I would be more than happy to do is to talk to you and the board, about, sort of what opportunities there are, maybe some good places to start. A lot of the work that we've done, because we're funders too, I think that that's an interesting, place where I can, what my council has been doing, what I've been doing, providing insight to funders who are interested in DD more, that know that that's something that they want to start doing, that they're just kind of trying to figure out how and who would they go to and how would that work. More than happy to talk about, some of the grant projects that we have that sort of help sort of spur some thought or inspiration, but then also just kind of where to start with, what you're asking people to do and the services and how to look at and understand like what might be needed in your community and how to get that information. I'd be more than happy to have that conversation with anybody.
And just, the division pumps out a lot of information, not just sort of policy, but also what's going on in their space. In terms of, things to be aware of, the council does too. I follow them on, is it Twitter or X? I don't know if it's popular to say that I use that platform still, but I'm not very social media savvy. But any one of our organizations, for different reasons, do have public facing social media or advocacy or informational things that we send out. Just if you want to be interested as a human being and active, as opposed to maybe more formally. But yeah, just wanted to add that. Is there another? Should I send it? Who wants it? Nobody?
Well, I could say another thing. Thank you for mentioning the Growing Health Coalition. That is a really great organization. So Jason, I could bring you to one of those Zoom meetings. It's really interesting and they really do talk about what's important to them, which is a great place to start.
Yeah.
I'm the administrator for, I think it's the largest 377 board in the state. And I just want to say it is not the answer to everything, because we have to operate under the same rules the state operates under. So the answer is in helping the state advance those rules toward the flexibility that people want, and then also building that workforce up by all of the means that you've already discussed. But I just wanted to shout out Growing Home.
Yay.
Great answer.
Other questions? We want to get into weeds, like some of the issues in our county.
Oh,
Yeah.
sure. I don't know.
Well, you can-
I was more excited than you were.
Karen is also our compliance manager. So a lot of things come to her, but for example, we're gonna be having a case review coming up. Did you mention anything? No, you didn't. Yes, oh, we can't. Yes, we do have to be careful. No,
Sure.
we're not gonna have any names, but
Did you say hypothetical? before
Yes,
they say-
hypothetical.
There you go.
A case of a 39-year-old,
Ultimately, somebody who's not diagnosed before.
not diagnosed
But suspected IBD.
and needs placement.
The 377 board is the answer.
Yes, and needs placement. I know we're the answer, but we don't have, in McHenry County, there's not much placement. So we are struggling for placement options. Where do you feel we could go for things like that? And resources for us, there is going to be a professional staffing coming up. That we
Okay.
could add people on a state level or like if you have any names for us that we would love to help.
I was gonna say, he's not diagnosed at this point. Does he have, this hypothetical person, has not been diagnosed with IDD? at 39?
No,
No, has he
no
got,
official.
no,
diagnosis.
any access to any kind of historical information, school system, special education, just digging in the weeds, any kind of, anything?
Well, we were just contacted about this. So what happens in the community for us in McHenry County is if there's difficult cases, they'll come to the mental health board and we help collect the group of participants to
Mhm.
staff some difficult cases.
Uh-huh.
So we don't have a lot of information right now because
Okay,
we haven't
okay.
done the staffing yet. Do you have any further information, Karen?
No, they're having a hard time trying to track down any records.
Okay.
And so it's kind of that, what happens when you do have somebody
Mhm.
that this is suspected, but there's no paper trail of that.
And that's the big,
I can't even hear
that's the big
That
hurdle.
stinks, big time. Yeah, that's a hard one. Without giving up on that part, I think it's worth it to go back and dig. Where did they go to school? I mean, you might need some big digging, but what can we get that exists on that person? It would be major digging, but what could you get that exists on that person? I would go back to school. 39, it's not
Yeah, it's not,
that bad in that there could be some finger crossing that something might have existed or a document report, like permanent record situation, special education, something.
she's right. So, that's the big hurdle. So of course, diagnosis before the age 22. However, he is this hypothetical person is only 39. So it's better than 60, and we have been able to find stuff for people that are significantly older. Family have, their graduation certificate that specifically notes something, right? Like a special education program, or at some point, there's a medical record somewhere. Digging.
Yeah.
Yeah, it's gonna be digging.
Other questions? I have another one, but I said, getting into the weeds, I probably don't need this, but,
And I know this is probably us too, but what about for like adult daycare or day programs? Adult day programs, and those families that are privately paying. For example, we've got, give you a situation, $75 a day. There's a family that's privately paying. And recently has asked, they've been doing this for years, they're getting older. Is there any other resources for families that are doing private pay? That you're aware of besides us
Or day services?
for day services?
If you wanna email me,
okay,
and then we can talk I'm not providing an answer on hunting. I'm saying, if you wanna email me, so I can get a better understanding,
Sure.
specifically, and then Beth and I can talk internally.
that would be great, thank you.
I private pay on waivers, so.
Right.
Yeah, I wasn't ready to say that.
Or are they receiving any other kinds of services?
I don't believe so.
Yeah.
I believe it's just the day program.
Because that might then also be one of those things where maybe it's time to start figuring out eligibility for services that person might be entitled to, or eligible for. And go ahead, now that so put him on the list for digging as well, as far as records, information, and maybe trying to start to establish, if he is somebody, or this person, I don't want to make, it's just so many assumptions to be made, but somebody that has benefited for a long time from that kind of experience. I don't want to make any assumptions, but probably would benefit from the look at formalized Medicaid.
Right, and especially since the parents are getting older.
Yes,
Yeah.
yeah.
I think that's some of the biggest hurdle is, families have, covered what they've covered for years. And they do, and now they're getting older and they don't have the records, and formalization was not established for IQs or developmental disabilities. And so we encourage all families, like, keep copies, make sure that you have documentation, even if you're not signing up for anything right now, just in case you ever decide.
Right.
to. Yeah.
Right.
That's right.
Hey, I need to apologize to you guys. I said growing home, which was my father-in-law's project, going home.
Going home. Oh, I heard going home.
I heard going home too.
So anyway,
Okay, whoop, sorry about that.
Okay, I have two quick questions. Well, the second one's not very quick, but for the puns list, and so this is somewhat personal. My 15-year-old has high functioning autism, and so when I have to do the renewal every year, right now he doesn't need any extra support. He's getting what he needs from us and the school. And some of the questions that they ask are, like, I have no clue if he will need intensive services. I have no clue what he's gonna need as an adult. And like, well, you have to answer yes, that you may need this as an adult. So I can go along with that. However, with like the puns list, like, so we're trying to promote as much independency with him as possible, and that would include him being able to report or say, hey, like, this is where I'm struggling as an adult, this is what I need. So like the puns list, will he at some point be the one that is asked these questions, or will it always be, because I'm not gonna be his guardian, like, he will be able to be his own. He won't need a guardian more than, like, is it always gonna be me that answers these questions for the puns list? Or at some point, are they gonna start contacting him? Because he's gonna be like, you all are crazy, don't contact me again. And then which, okay, yeah, you have that right, but then he may, as an adult, at middle age or at some point, he may need those services.
Yeah.
And they're like, and he may not, like, I may be long dead and not be able to like pay for it, and he may not be able to pay for it. And so then what the message I'm hearing is, well, this is kind of too bad. So like, do I like train him to like just say yes, always? Like, what am I supposed to do?
I'm gonna go with no.
So before I had the job that I have now, I was overseeing citywide transition services for Chicago Public Schools. So and there's 69,000 kids with IEPs in the city of Chicago, by the way. And it was me and a team of 4 that were over all the transition services in the entire city, which is also, it was a challenge. I like to do hard things apparently, but so when you were asking these questions, I wanted to really answer you from the person I was when I was overseeing transition for Chicago Public Schools, a lot of kids and a lot of families, and the way that I want to answer you as a mom of a 15-year-old is to do your very best to make sure that when you are, that your documentation matches the fact that he will probably need help in the future. If you're thinking long-term, there's no way to tell, right? But if you think about your son and you think about long-term and you think he might need help with getting a job someday, or he might need that extra job coaching, or he might need someone that's going to come in and help support with cooking or groceries or whatever, or he might need some socialization pieces, or he might want to belong to something, or might want to go to a day program. I have no idea because I don't know your son at all, but what I would say is that if you can see him needing help, then to stick with the concept that he will need help, and that you are formulating your IEPs to show that, you know, again, we want to empower and make sure that he is going to go on and live the greatest, best, most independent life on his terms that we possibly can, but you're needing to also kind of consider, so you're not the same place as the individual who doesn't have any records trying now to get eligible, to try to ensure eligibility as you go along. And then let's just say he's 26 years old all of a sudden and then pulled from the punch list and now has to make a decision as to whether or not, first of all, if he's not eligible for Medicaid now, which might be also something that you want to kind of start looking into and figuring that out. If he's eligible for Medicaid and then deemed eligible for services when he's pulled off the punch list, he then has a choice at that point to decide what he's going to do with that information. And there's a lot of different options once you get to that point. But I don't think that there is any harm in talking to him about what some of this might mean. It's going to be really hard at 15 to get him to think about that, I'm sure. But if you're holding that in the back, I think protecting eligibility is an important thing. and protecting documentation is an important thing. And then when the time comes, you'll be able to make the decision that's best. Now, would they be the one that's contacting you? Now we can get into all kinds of conversations around supportive decision-making or versus guardianship or powers of attorney, or, you know, other ways that maybe you can, without being a full guardian, that's so restrictive, without being a full guardian, that might also allow you some decision-making support in the best interest of your son. That doesn't include full guardianship, and there's a lot of different options there as well. And I would be happy to follow up with you with resources too, if you want.
Thank you.
Yeah, I was just gonna emphasize, you know, starting early and encouraging him to be open to supporting decision making. It's obviously sounds like you're really encouraging independence and for him to be able to stand on his own later. But him feeling comfortable with like, well, beats me, they asked me this question. And if you're no longer around, what do you think? And him being willing to ask those questions and get that support. So that, like Kim said, you know, guardianship is very restrictive. There's also limited guardianship, but still, it sounds like you're really doing a great job of encouraging independence. Then encouraging him to ask for help when he doesn't understand will be hugely beneficial, along with all the documentation.
Yeah, I just have one quick other question. He's funny because now he has a 504, and so now he's very active in those conversations, and he's like, I don't need anything, and I'm like, no, you're doing well because all these things have been in place for 10 years, but he's also a teenager.
And they need nothing because they know everything.
I said that earlier, I live with the smartest person ever.
Exactly, and
Yeah.
all of our IQ points fall significantly as soon as they hit double digits.
Yeah,
So.
yes. My other question is, so we do have a 377 board and provide funding to the community. And I've noticed with one of our bigger agencies, they continue to grow their pediatric services. And so they get higher reimbursement rates through that. And so like, it is just really growing. And then like the CELAs, they're just closing more and more of their CELAs. They've reduced from like, providing housing to over 50 people. And in the past couple of years, it's more like 30 people. And so of course, their reason for that is they said that they don't have enough people to fill those positions. And then also the state funding isn't enough. So they've said with that the state reimbursement is only for DSPs, and so they also need supervisors like over those DSPs, and the state funding doesn't provide for those supervisors. I think they call it like OSSs, if that means anything, for those supervisors. And then with like the higher DSP hourly rates increasing by like the 250, they've said, well, now like the amount of hours that are reimbursed are less because of that. So I don't know if all of this is necessarily true or not, and so I'm just asking your guys' feedback on the funding process, I guess, of housing or CELAs. If you have any other thoughts on housing, period.
Where are you at? I'm just curious.
McLean County, like Bloomington.
Well, you want me to make it up and then you can tell the truth?
Yeah, go ahead.
So like, you know, that's a lot to unpack.
Yeah.
And some of it's connect and disconnect. Like, I think I know the organization, but I don't know 100% sure. This would just sort of be my perspective as informed by, you know, our members in terms of what they see on the ground. The hours issue, that is a lot to unpack on its own. But what I would say is that starting our next fiscal year in July, that providers are reimbursement, their per diem is going to change based on the number of hours that are allocated to an individual that's being served based on the severity of need. Okay, and we're not going to know some of those things until very right into the beginning of the fiscal year. So when people are talking about hours, a lot transpired over the last year in terms of the direction that we looked like we were going to where we're actually going. And I think the director can speak more specifically about the plan that they've got in place. It's a plan that makes sense. It's a plan that the community, I believe, is supportive of, and it's just a matter of can we try to do it as efficiently as possible. But remember when I mentioned aging technology earlier, that's a big pain in the butt that I think is gonna maybe potentially create some issues. What would you mention about the $2.50 an hour? Well, here's the thing, contraction happened during the pandemic. And it's still happening in some places, almost purely driven by workforce. And the case mix and severity of need that individuals, or that organizations are serving. So I hate to see it. I don't think any provider wants to just say, hey, well, we're gonna close up and consolidate. But our ability to expand, especially in the solo program, is almost purely driven by the availability to recruit and retain staff. And so that $2.50 an hour is intended, I think, to make the environment better to hire people. The higher DSPs predominantly. Frontline supervisors, there's a component to the solo rate structure that I think is intended to help address that. And there are different costs or different components of the solo rate that are going to grow over time based on statistical data provided from the U.S. Department of Labor. The DSP one is the one that's just sort of like really tied to what the state is going to agree to reimburse and put in the budget. That said, there's wage compression in our space where the professional position, the QIDD position, the degree position, you know, you're seeing DSPs based on overtime and hourly approaching those wage levels. And it may be that the rate that supports Qs is not growing fast enough. Things that are a lot to unpack. What I would say is overall the funding structures are getting better, and the expectation is as they get better, that will increase capacity in the solo program. So if I made any of that up, I know that you'll keep me honest.
So as Josh said, we do have a aged technology system.
It's not your fault.
It's actually older than me, so I am not taking any credit for it. But with that, over the past year, lots of discussion has gone on. There is no hours coming out of the system. It is a redistribution of systems, but we're also looking at what individuals do need. So with that, updated assessments, so on and so forth, so that will impact their services being met through the rates. And so, and yes, as Josh mentioned, we're gonna run it to the line of the fiscal year. Exactly, it's gonna work like a well-oiled machine, and we'll have those rates out at fiscal year.
I also really get sad when I hear that providers that feel like they can't innovate. And I think with an eye to the future, it kind of goes back to the housing conversation that we had, that I just brought up a little bit earlier, in that I truly think that providers are going to have to start providing services in places that they don't own, or else we're going to run out of housing. It's too expensive to own these big old buildings that people used to own and to keep them operational. And, you know, I think when we're looking at like the future, I really hope that we are able to, you know, continue to figure out what's going on with the barriers that exist within our system to allow providers flexibility to be able to better go out and provide services. And the vision that we have is any apartment that's available to rent can be a place where somebody lives and receives supports. It doesn't have to be a special building or something that somebody else owns. Like, it can be, some communities have market rate rents that are even affordable by someone that is only receiving Social Security income. Now it's tough, but sometimes, or there's subsidized housing options, et cetera. So for the future, if it's because the cost model is too expensive to own buildings, let's stop owning buildings and start really working in other, you know, smaller spaces or mixed use buildings and things like that. So I think that that's kind of, I think that's the future of probably where some of these things are going, also given how much it costs to own property and all of that too. So I think that there's a lot of potential for that. So I always get a little sad when we can't figure out how to innovate, because this entire field has required innovation from the beginning, which is why that family has been paying themselves for their son to engage in those activities, because they had to innovate. Somebody probably told them no somewhere along the way, and it probably wasn't the right no. And then they thought that they couldn't do something else. So now they're starting to do this because people are just getting their own needs met in a lot of creative ways. And we need to figure out how to make it easier for them to do that. So I get sad if folks feel like they can't, or they feel stuck and can't figure out how to innovate. Anyway, I hope that's.
Yeah, no, I appreciate that, and I think as you guys are talking, some of it is more they want more reimbursement for their agency to
Mhm.
have some extra money versus how much their DSPs are getting paid, I don't think is the bigger issue.
The innovation of agencies not owning their own facilities hasn't been very popular.
Mhm.
Because they like the line of credit is important,
Mhm.
so.
Yeah, I mean, there's reasons why the system has come up the way it has.
Yeah.
Mhm.
And, well, yes, there are reasons why, and
Yeah.
our history in state government really sort of justified the need to have, when the state was a very slow payer for services, and, we were carrying payments on behalf of the state. I mean, it was a different environment, and how the SILO program itself came up was a different environment.
Right.
There are states in which there are services being provided by agencies to individuals in which these are not owned by the provider. I'll just be honest, I'll have members that will not agree
Yeah.
that is the direction to
Yeah.
go, and not just purely because they own a lot of properties. Some philosophically believe that they have a liability to keep an eye on, and so I think it's a mixed bag. That said, why I was kind of clapping back here is we have to express a willingness to explore doing things differently with different expectations. And I think, overall, at least I think I can speak for my members because we're heading that direction, is, there's a belief that yes, we have to evolve our service models, how they're reimbursed, how they're regulated. But just when it's right here in the face, there's a little bit less of a willingness to change. But I mean, Kim's done amazing work, and, I think IHDA just announced, approval of some more housing projects
Yeah.
just recently.
Yeah.
And, what I'm excited to see is I've got more of our members that are like, oh, we need to take a look at this. And that will, and when what I will characterize as well-known, well-established, credible providers begin to work in that space and provide those services, other people are like, all right, we can do this too. And I think we're seeing that.
I just, like I said earlier, I mentioned collateral damage in the system. I think we're probably really familiar with families
Yeah.
who's like really are traumatized.
Yeah. Yeah.
They really do need some special considerations that we may not have figured out yet. The providers are the same. Like that
Yeah.
is a great idea, but I think people are going to be skeptical until someone else makes it work for them
Mhm.
for these historical reasons.
Yeah, which is why we try to create demonstrations
Yeah.
that these things can happen. And that's exactly what we're in right now with a couple of different projects to show that, it is okay. And it happened over here, we're modeling it after this, and the sky didn't fall here so that we can do it here. And we're constantly trying to break it down in that way to keep it going. And I feel like that's, give a topic. And I feel like that's probably the approach that we've taken to just show that something can work. It's okay, it can work. Now let's try to scale it. And I think that's one of the roles of the DD Council in the state, is to try to push for some of those innovation pieces that, kind of freak people out. But I think we're gonna be okay. Let's keep going, step by step, and try not to leave anybody behind as we're trying to push forward. I know it makes people nervous when I say things out loud, like you need to provide services in places you don't know, but at the same time, like, I don't know how else we serve all the people that we know need it
Right.
without thinking about that.
And it was an utter failure for us. In Champaign County, we have a lot of money to put into developmental disabilities. We tried that.
Yeah.
And it was very difficult for the providers to do, so.
Yeah.
It failed.
And that's the part where we're trying with the navigation projects that we're doing now. I think that's the interesting thing. Because you all are out doing creative pieces, that's an innovative project. But maybe there's a little bit more of an opportunity to partner on, like,
I think so.
would love to help you out and unpack the policy that made that not work for that provider. And I'm thinking community choices, you've got so much, but anyway, you got great,
Yeah, we do.
awesome folks in your
But
area.
they're not gonna take steps that look like steps toward disaster. So.
Sure, well, let's not make
Even
them
if
look like
they're
disasters, and I think we,
strangers.
yeah, and so I would be happy, because I think maybe that's for part of it, because you guys are gonna run into, which is why when we started this housing navigation project, it launched with also side-by-side support with the division. We're going at it together because we know if we try to start this, we're gonna uncover 50, 1,100 dozen issues. That we're gonna have to untie those knots to make sure that the program can keep going. And that's side by side piece is what helps. So I think you're probably running into barriers that, unfortunately, they get, maybe there can be a little bit more of a tie-in, and those kind of systemic pieces. Would love to collaborate and understand more about what went wrong to figure out how it can keep going, because, I think that hopefully there would be some opportunity for somebody interested to do that. And I think as funders, because I just got this speech 2 nights ago, and it made me, it really helped. I think, I think that we need to acknowledge, and I don't know how you all shape your projects or not, but this really resonated with me, is that sometimes when we are funding projects, we are asking impossible things of the people that we're giving money to. And with our short windows or our expectations of impact upon fund, I want to see your impact report in the first week. Let me see. Like, I think we need to sort of shift a mindset into, we need some resilience funding that's going out into our community. Like, we need to be able to be perfectly okay to just fund people to not work in trauma zone all the time. Maybe having a little bit of extra cash to be able to kind of start to breathe, to kind of start to think, to kind of start to innovate, as opposed to expecting it upon delivery. I think is something that we need to think about. I think it's perfectly okay for people to say, we need funds to exist so that we can put out this part of the fire so that we can start to look to the future. And I think that that should be an okay thing for us to think about, particularly given what we've all collectively been through the last several years around, like, you know, trauma at every corner. And everybody's been through it in some way or capacity. And so how are we sort of also using the opportunities that we have to help, you know, folks thrive that want to do awesome things, to also do it in a way that isn't expecting too much or as an impossible act.
I like this new funding model.
Thank you. Thank you.
And I don't know, I might not,
Yeah.
I might not need the mic either. Can you guys hear me? Okay. Oh, okay. Oh, there's one back there. Oh, right. Doesn't matter. Oh, you're here.
First, I wanted to apologize because as many of you were talking, I have a SAMHSA grant, a collaborative SAMHSA grant that is due that I was working on, so I want to apologize. It didn't seem like I was, and I want to apologize for that. Getting back to innovation, one of the things I love that we're all here and we have this shared vision, shared mission, because we are, you know, doing our best in funding many services that, you know, don't have funding.
Yeah.
Also, we've funded SILA's startup, SILA's, because, you know, those capitals aren't there.
Right.
So we've done that in our community. But one of the things that's really lacking is what you had talked about regarding the short-term and long-term stabilization housing, as well as residential. I mean, we have our kids, for example, that are going out to New York,
Yes.
Yeah.
that are going out to New York. And families that, you know, so what can we do as mental health boards? What can we do innovatively? Because we want to partner. We want to partner with councils. We want to partner with the state. We want to partner with private entities to bring these services in. So what else can we do? Where do we start? I would love to have short-term and long-term stabilization
in your area.
in our area.
So as we mentioned, we are going to be expanding short-term and long-term stabilization homes. That will be a submittal by, you know, providers of who would like to do that and going through a review process. Currently, we have some short-term, and so I'm sure that they'll be looking to expand as well. So we're very interested to see where those will end up. Going. We know that currently we have some in Springfield and in Chicago. But multiple people have mentioned the need for them farther down south, as well as over in the Peoria area, Galesburg. So a lot of people are interested, I think, in getting those to work.
Well, we're in McHenry County, so if there's, I mean, we're in the northern part of, and there's nothing around us. So we would love to have more of those opportunities. What about in the private sector?
What do you mean private sector?
Well, some of the, residential facilities aren't necessarily run by a state. So partnerships there.
So again, by provider agencies
Right.
in this, and so compared to our residential, like state operated
Right.
or MCDDs.
Right.
So expanding with private agencies on the residential side because currently our ICF IDDs primarily serve, I would say, more medically inclined there, and they serve approximately 3,400 individuals in the state.
Yeah, I was thinking more about the situation with the kids that we're sending to New York.
Oh, so for juveniles,
Oh.
for children or
Yeah.
juvenile
Yeah.
areas, one of the things that we've talked about and are looking into is what do those states provide that we don't seem to be able to provide in our own state?
Right.
And why is that, right? I mean, why is it? Is it too high a risk in the state has been determined by those that would provide the service? So we are looking into, why are they able to provide that service? For example, Prater-Willis. We send an enormous amount of individuals outside the state to receive that specific service.
Can I just to say one thing? So, the governor's got his children's behavioral health transformation out of his office. I think we're going on year 3 of that initiative. And I mean, it's a big project. Big project, and big projects take time, but this has been the best that I've seen from what's been reported out in terms of at a statewide level trying to take on an initiative. Children and youth with IDD or autism with behavioral health support needs, even though we are sending several out of state, it is a small part of that big effort, but it's been acknowledged in the reporting that's been done by that office that there's a real capacity issue to serve this population. It's acknowledged, it's part of active discussions for the intermediate and the long term in terms of, but not just to be, my understanding of it is not just a shotgun approach to building capacity, just like, okay, we need a home here, build a home here. It's more of a systemic way of building capacity. We've lost it over time. I mean, more of the institutional models, but there are less than 10 children's group home providers in the state of Illinois. And most of them will tell me the reason for that is the needs of the children and youth they're serving and the reimbursement for it based on the current models. I believe there's a provider, I'm trying to think of my mental map where Rockford is in relation to you, or whether that's Northwest.
There's kids in here.
Winnebago,
Yeah,
right,
it's
that's
right
Rockford,
there.
right? There's a provider there that's engaged in a partnership that's been working with the division that is trying to start initially with a no number, but a high intensive residential service model that they plan on growing, and they've been working with the division on that. I hope I'm not speaking out of school, but those are the kinds of, that I hope, at least innovations that our members are trying to bring forward. They want to do that very intentionally. They want to make sure they set it up for success. But what I would say is, for me, at least, is our members learning amongst themselves what they're willing to innovate on. And so if this model is successful, those that are willing to assume the risk of serving children and youth, they're going to look to that model and they're going to want to grow. They're out there, it's just, it's staffing. I hate to boil it down to something as simple as that, but there's a willingness there, so.
Well, and to build off what Josh said, I think that the governor's goal for the Children Behavioral Health Network is a really strong effort to keep children home, right? Like, what are the services we can provide and support with the families so that we don't need huge residential providers, but when we do have the need, we're able to keep them in the state.
I was whispering, sorry.
Thanks for the water. Yes, we all appreciate water.
I want to remain anonymous, so you know who I am when I ask this question. Jim Russell, Vermillion County Mental Health Center.
Where, I'm sorry?
Vermillion County,
Okay.
Danville. I've had some conversations with business leaders and managers. And I think they have more of a lack of knowledge and ignorance about what comparative wage means to them as what I even do. I don't think they've been involved in the conversation at all from the state level about what that means. And most of the people who I talk talk to believe that means as a company, as a business, as
Yeah.
an owner, as a manager, they're gonna have to pay the exact same wages to somebody with an intellectual and developmental disability as they do somebody who does not have a disability.
Right.
And the question they ask from a purely business standpoint
Yeah.
is, why should I hire somebody who's not gonna be as productive because of their disability as the person who doesn't have that disability? What am I answer to that?
Love to answer that question. Okay, so, lots there, to unpack. And so let's start from the beginning. I think, the folks that you're talking about are, like business owners in your area that own, I don't know, a grocery store. I mean, the people that employ people in your area. So just regular shop fronts or stores or businesses, restaurants, that kind of thing. Okay. So there's a couple pieces here. First of all, I think that when we, the state has an entire, line of service provision that might not be something that I don't think business owners are really well aware of. And I think that that's probably a shortcoming and something that would need to be, addressed as we're kind of thinking through this transformation of working to get people with people with disabilities in general paid the same wages as everybody else. So first of all, you can't pay a person sub-minimum wages currently unless you have a certificate from the Department of Labor that says that you can. So I wouldn't think, or I would hope that regular businesses probably are not also certificate holders or people that are able to pay people less. Because when you are able to pay people less, there's an entire series of requirements and paperwork and things that you must do in order to prove why you're paying this person less than a minimum wage. So I would assume most regular, shop owners or regular businesses probably do not have that certificate. They wouldn't be able to pay somebody less anyway. And I think to them, for me, I would say, you would be hiring somebody that would hopefully benefit your company. You wouldn't hire somebody that wouldn't. And so what I would hope is that if there was somebody with a disability that was knocking on the door to try to get a job at one of these local places, that it's hopefully somebody that's received a really good amount of support on the front end that made them really ready for that job. And then when you enter into that, then that employer would hopefully be and see all the benefit that that person can bring to their work. I think there's some element of stigma attached to sort of some of the question that you brought forth. And so I think also we need to work to make sure that we are not allowing some of these harmful stereotypes to follow people into these different environments, because there is no world that I live in that just because you have a disability means that you are less than, or that you can't do something as well or better as somebody else. You just have to find what you're good at. I think that's the same for every single one of us. And I would hope that that could maybe be some of the messaging back to some of these employers and be a little more open about the possibilities of extending an opportunity to somebody. So I didn't know if we were going to go down the train of, there are a lot of service providers that do have 14C certificates that do run day programs that do pay people sub-minimum wages for contracts, and then when the people go to these programs for the day, they work some of the time in these sheltered work environments and then get paid, sometimes, I think my friend Vincent worked a week in a sheltered workshop and got a paycheck at the end of the week for, I think it was like 68 cents. It was less than $1. And he couldn't even get it cash at his bank because they wouldn't cash a check for less than $1. And that was his first and last week in sheltered work. But there's a lot of folks that go and find value in the opportunity to go to the same place every day, see the same people. They like doing the same thing. They might, some folks portray it as they're not necessarily there for the check. They're there because they like to feel like they've got something to do. For that piece, I would say we have an obligation to make sure that we're finding out what makes that person feel like they belong there and keep that up. It doesn't mean that you have to stop going to the same place. It just means if you're gonna do that work, you should be paid regular wages, or we should find something else to do that's also really meaningful to you. Because sometimes I question whether or not the 69-cent paycheck at the end of the week is really what's keeping you there. So what is it that makes people want to belong and be a part of these pieces and make sure that we're providing that in a different kind of way that's not discriminatory? So I kind of answered that in two parts. I hope that the employers in your, in the area that you live in, employers in general, take a chance on a qualified person. And if they're not 14C certificate holders, they wouldn't be able to pay them less anyway.
Yeah, and just to add on to that, one of the strategies we've taken in Oak Park is to have, instead of the service providers or the mental health board talking to the business owners, we have business owners talking to business owners.
Yes.
So the business owners who are currently employing individuals with disabilities, bringing them in through the chamber, through other places. We have, so Disability Employment Awareness Month is coming up in October. We have a whole series of events going on with our Chamber of Commerce. We're bringing in those employers. So they really want to hear it from other employers, and other employers really say, you know, really talk about it like it is. And yeah, what they've seen is that those employees are the most consistent in showing up, and they're always on schedule and do what they say, you know, and so there's so many benefits to it. And then also, a lot of the employers have had good experiences with the supported employment program, so that they know that if they bring in a potential employee and it's not the right fit, that supported employer agency doesn't want to shove that person into the job either.
Right.
So it's not going to be on the employer to say, well, this isn't a good fit, and now I have to fire this poor person, you know, it's not like that. It's like really finding out what the right fit is for the abilities, and then knowing that they have the fallback of having these agencies to help. So the business employers are really the ones you want to have having those conversations.
I said this
Great
earlier, yeah, but I agree. I mean, the long-term success and changing the trajectory is going to rely on private businesses, and it's going to be, you know, it's like innovation models that we talked about earlier. Peer-to-peer communication on what's possible and learning experiences like Champagne. I can't think of the name of the president. What's the name? Lee, that's it. I mean, DSC is a member of ours, and almost every other day they have staff, and I think they fund that, I mean.
Oh, yeah.
Yeah, or going out to private businesses and they have like a certification conversation with businesses just to learn more about disabilities, people with disabilities, benefits and values of employing people with disabilities. That something as simple as that can have a profound impact on changing people's understandings, and we need to see more of that. And two additionally, I know there's some questions still. And to your other point, to the point gentleman made earlier, I'm going to separate myself for a second, but the community is successfully, I think, articulated minimum wage at least as a civil rights argument, and have been effective in making that a civil rights argument. You know, I have the luxury now in my role that I have organizations the board that recognizes that this is an idea that time has long come, and that regardless of disability, you should at least earn a minimum wage for an hour of work. Can it be difficult? Does it require facility-based employers to rethink their models to maybe try to figure out how to finance employment differently? Absolutely. But, you know, you're guys going to have a chance to take a look at legislation here probably in a week or two that is going to try to incorporate some of these concerns so that Illinois can get on a trajectory to phasing out sub-minimum wage. And it's going to require bringing everybody to the table with their best ideas, but it's not an insurmountable object. Tim said this, the entire history of disability services in the country has been how we limit the expectations of people and realize that we've done so falsely, and evolve our expectations in thinking and empower people. And this is a space where that's a case that I think we just need to overcome it. Sorry, I'm off the soapbox now.
Yeah.
So I was thinking about this
during all of your presentations, and all of you mentioned it very briefly, but it relates back to this employment discussion, is transportation.
Yeah.
And so one of the things that we're finding, I'm from Hanover Township, and that's suburban Cook County. So there's a lot of great employers that employ a lot of great people with disabilities, and we have a lot of agencies that are providing, great employment programs.
Good.
But transportation for
Yeah.
people is the barrier,
Mhm.
you know, so getting folks to work and back home. And for our caregivers, that is the biggest barrier that they have. And the cost of transportation continues to rise, outpacing, you know, any kind of wage they're getting, whether it's sub-minimum or not. And so I'm wondering, you know, each of you mentioned transportation, but it was just sort of transportation. So I'm wondering, what kind of movement are you seeing? What kind of innovative things are happening? Our mental health board supports transportation in different ways, but we're also like reaching, like we work with a cab company to provide subsidized rides to
Yeah.
people with disabilities to work and back. But that cab company is reaching their capacity.
Yeah.
Which is great, but then what? You know, like then what do we do? And then I get calls from residents of other townships or other municipalities wondering where they can go for transportation. I don't have anything to tell them. So I'm wondering what your thoughts are.
Well, we haven't fixed it. No.
No?
No. Very Italian, we haven't fixed it. No, but there's two things I'd like to say. First is, I would love to know collectively what some of the ways that you are locality level wise doing to address transportation. I would love to know that, like subsidized cab rides. Are there any other ways that your boards are subsidizing transportation or doing anything innovative with transportation? I would absolutely be thrilled to hear about any of it, because I think this is an extremely tough nut to crack. I don't have an answer that's going to help, but what I will say, and this is how hard I think going back to innovation and change and in trying to do something it's a long road and it's difficult to do. We started, I want to say about 6 years ago now, with a really visionary and awesome provider, and who had a great idea. We had funding that we put out. It was, again, I think like 6-7 years ago, where we just said, we had some funding where we put out, tell us what your problem is and how you would solve it. And that was sort of the premise of our grant opportunity at that point. And so folks came to us with ideas, and I'm sure you guys are all got that trick in your bags too, of like, you know, tell us what we can do. We don't always have the answers of what we need to fund, so you tell us. We got an idea at that point from that provider to start an app for sort of like ride share and ride requests specifically for the disability community. And it was called Scoot, and I think it is in the App Store, but here's the thing. It was started under the premise of just within his, he was a service provider with a lot of different people that he served in a large area, and really wanted to focus on getting them rides on demand to the things that his staff couldn't get them to normally. So like church or other, you know, the movie, like those, you know, like these things that sometimes people that live with a lot of other people with disabilities have to do as a group, you know, it's like, how do we get more independence there? But then also work, right? And how and on demand. So how do we get, at the time, the appetite was not for using regular Lyft or Uber, or it didn't exist reliably where they were. So they really wanted a ride demand system specifically for the people that they serve, app-based. And then the vehicles that they would use would be ones that they owned, or they could use personal vehicles. And the people that would be driving would go through their training so that they could be a certified driver for this Scoot program. And some of this sounds pretty straightforward. You can use your own car, you can use a car that they own, you can use, so it's really kind of like a microcosm of how Uber and Lyft work. We're 7 years into this. We've experienced some really sad disruptions with the project, but they're still carrying it on. But we figured out that the insurance, they fought through the insurance pieces, they fought through, you know, the training and the certification. I think we might have had our first ride, like within the last, I don't know, I think within the last like few months, we might have had like the first ride requested, that was answered, that was delivered, that was successful, and it was done under a pilot still, it's still not like open and out to the public. It's taken us 7 years to get a ride. Uh-huh.
Wow.
I know, but look at all the things that were figured out along the way to do that. And so we're trying now to figure out what's next for this, you know, and how can we get, you know, how can we get the premise out to more people? But that's how long some of those things take. So I didn't want to, I wanted to just highlight sometimes just how difficult it is when the concept is so simple. But when you start to actually get into it, like, holy buckets, it's been really hard. And then to even just app development in and of itself is a whole other thing that I also don't understand, but I just know it takes a really long time. And it's expensive. But anyway, so I don't have the answer. I think that innovation is important. I love to hear that you're subsidizing in companies that are in your area. And if there are other ideas that are coming from this community around transportation, I would love to hear what they are.
Karen, you can talk about Kaizen.
That's for behavioral appointments.
It's for treatments, right? It's not just, oh, not for employment, but it's still, yeah. I mean, we have a platform that we've been funding called Kaizen. And those of you that are around the Chicago area may be familiar with that. But it's not for employment. What we do is, it's for our funded providers and their clients to get them back and forth to treatment if there's treatment issues.
Okay.
So that's how we
Uh-huh.
developed it and how we fund it. And the platform is great. The platform utilizes whatever transportation, it's a company who organizes it, and then they subcontract out with Lyft, Uber, Metavans, you know, whatever is needed for the transportation, but it's immediate. So there's a request, there's a schedule, there's a pickup time then that goes back to the client, and it really works out well. We actually devote about 250,000, I believe, in our budget for Kaizen a year. It's utilized by our providers and by our clients. Again, at this point, we don't use it for employment. We use it to go back and forth for treatment. But it is something that is utilized, and I think it's a great plan.
That's awesome. Can you spell that?
Yeah, I'm not sure it's an app.
Okay.
Kaizen, but I'm not sure it's an application
Sure.
yet. It's a web-based,
Okay. Awesome.
but you could utilize it in any format you wanted. So if you wanted to use it for employment, it's just the way you develop your contract.
So there's a lot more ideas out there than we're even aware of. Transportation did come up consistently in the rate study as an issue, and it's going to be a part of the phase out of dignity and pay, which is acknowledging the challenges of transportation. But granted, there are going to be certain transportation needs depending on disability and comorbidity, but you know, I think, you know, with rideshare technology, certainly, you know, and with the amount of money the federal government puts into federal transportation programs, this is not an insurmountable hill. It's just going to take some out of the box thinking. That's easy for me to say, but it's going to be in dignity and pay. It's going to have to get addressed and policy recommendations.
Yeah, and
For future Kim to solve.
And it's just tough, the transportation, we can spend so much money on it, and for us, it's used as a last resort. So it's not for ongoing treatment. So it's used for clients as like a last resort when there's no other availability for transportation. It's not meant as an ongoing. So that issue is just a tough issue, the whole
It is.
transportation, especially in the rural areas.
And to be honest, I mean, I come from 3 different states, and it's
Everywhere.
continues to be an issue, just across the board. Nobody has got the winning ticket yet on, oh, this makes complete sense for every location. Because, you know, as they were talking about, you know, providers, there's a lot of good employers out there that really want to employ individuals with disabilities because they see the benefit. There's really not a better workforce to employ. They're dedicated, they show up. But transportation is a huge issue. And if it's a huge issue in the North, which has public transportation, the providers we hear from in the South, it's almost impossible. You know, the one taxi they do have stops running at 9.
That's right.
So,
Or a bridge is out.
So we have a couple more questions from the room, the folks in the room here, but I just wanted to make an opportunity for anybody on Zoom. Was there anyone who would like to unmute themselves and ask the questions of our speakers? I'm not seeing anybody unmute themselves. I'm gonna pass this over to Amy.
I made sure no one else had a question before I found out another question, I just want that noted. Sorry. So for McLean County, we created the IDDC, the Intellectual and Developmental Disability Collaborative. And so it's just a place for DD agencies, people with experience to just kind of like network, share information, like collaborate, because we found out with like behavioral health, everyone talks all the time, like there's too much. And then we found with DD, like it just was not happening. And so we created that, and then we have an advocacy committee. We also didn't know there was like the ICDD. I'm like, ooh, that's cutting it close. But so we also have like an advocacy committee. So one of the things we're getting a lot of feedback about, including from one of our child psychiatrists, is like the schools are just not following the laws for IEPs and 504s. Like they're like, for one example, they will tell our local psychiatrist, like she's not allowed to diagnose people with autism. And so they don't have to accept that diagnosis. So it's really bad. Like it's an ongoing problem. Like it's at the point with like one of the schools that I think one of the parents is gonna contact Equip for Equality.
good.
Yeah, so, we are trying to then create like a flip book or something on here's information about IEPs, 504s. We have like a ton of information, but like we just can't find something that has like streamlined information that parents actually care about. Like, no, like, there's just some things like I love Civil Rights Act, but like, I don't need to know that when I'm going to an IEP, or a 504. So we're trying to create that, and I guess maybe part of this is just bringing, I'm sure you guys are fully aware that these things exist. Like as far as schools and IEPs and 504s, like I experience it personally, and then I know through my professional work, other parents experience it. But if you guys just have like any feeds, and you don't have to, maybe it's just more of an awareness thing, but if you guys have any feedback or any sources, like, is there already something created that's like a really good tool for IEPs and 504s?
Thank you. There are a lot of different kinds of like individual resources, how to get ready for my IEP, parents, how do you get ready for, you know, and there are a lot of things that exist. And I am more than happy, I'm gonna give you my card before we leave, and I'm more than happy to, you know, put together some links and just some things for you guys to start with. Also on supported decision making, circling back to your 15-year-old. So I've got a lot of stuff, and I'd be happy to share. I am really excited to hear that you have started a group that just comes together to chat and talk about things that you're going through and issues and whatever, because of all of the, I used to be a special education teacher. I used to run big citywide special education programs, and I've worked with a ton of families over the years, and I have never seen anything more effective than a mom helping a mom. Or a person with a disability helping a person with a disability. That peer share and that peer support of like, what was your experience like? Who was that teacher? How did you get this done? How did you, you know, that facilitating the open space for parents to be able to help each other is huge. And then the only other thing I would say is that, to me, IEPs are just like all of the other, you know, big meetings that you shouldn't go to alone. Ever, I don't think. And even if it's just to have a friend that's there with you to help listen, it gets emotional and it's hard to always pay attention to all the things that go on. So I think that peer support, that peer sharing, that peer help is in providing the space for, you know, workshopping. You know, there's laws that have changed recently where now you're supposed to get your draft of your IEP many days ahead of the actual meeting. It's not always happening. We know that, but there is an opportunity then to prep, maybe with, you know, and I think just even hosting and opening the space and just even providing that, you'll find how much folks can kind of start supporting each other. Also really glad to hear that you are aware of equipment equality, and then also, you know, I want to highlight as well that the Guardianship and Advocacy Commission has an IEP support and like a special education troubleshooting hotline that can also be used. That's recent within the last couple of years. I want to say that ARC of Illinois also, well, is a, maybe not so much IEP related, but like an open hotline just for calling to say, you know, I have a son or daughter with developmental disabilities and I don't really know what to do, or this is what I'm experiencing, and you know, it's called the Lifespan Project. And the ARC of Illinois provides that service as well, where it's just parents can just call. So there's a lot of things there, but I want to really encourage that peer support. And I'm really happy to hear that you guys are opening that space, because that's huge. A lot of things are just so unique to the school and the place you live too. That, you know, sometimes like these big overarching career IEP can help, and things to think about, and what do I want to say when I go in, and what are the roles that people have, and like I said, I'll share resources with you on that, but just preparing and talking and holding space for people is also really incredibly important. And not to downplay dads. Dads can help too. I didn't mean like moms are the only people that can go to IEP meetings. That is not true.
The message was pretty.
Dads are awesome, and dads can also help each other.
All of my kids.
Yes, I didn't mean to just say that was a mom thing. It's very much not. It's dads are awesome too.
Not as awesome, but.
We're gonna hand it over to Lynn, and then the folks on Zoom, I think we're winding down with the question and answer session, so please let us know if you have questions after Lynn's question.
I just want to come up here with you guys so I can see you. So I love that this conversation has kind of turned toward positive innovations. I also just want to shout out to, it's really hard when you're the first one to do it. So all the years you've been working on that out, I think one of our agencies is like learned, and because we just recently started funding a transportation support that's really successful. I think it.
Oh, good.
I think it took all of those tough lessons. They're quite involved with you, so you kind of.
Okay.
So anyway, enough of good news. I want to roll it back to really hard questions, because there's a workforce that we haven't been talking about. I think we've correctly put a lot of attention to DSPs, and we should continue to. And there's a lot more there than, I mean, let the check reflect the respect, for sure, but you also alluded to some issues around supervision. There's also, because we never bothered to survey DSPs until just a few years ago, and there are some other things that come up that we can work on, like cultural competence, like some serious hard-baked racism in the system itself, and things that we can work on as funders and as concerned community members. But here's the other workforce thing we haven't been talking about. The number one selected item on puns for decades of unmet needs is speech. And that affects, like, everybody here has got some involvement with early childhood. We know the positive impact of speech therapy in very young people, and also in the population that y'all were talking about, employers in the community who might be hesitant to hire somebody who maybe doesn't use language in the same way that we do, but they're going to be a great employer if you understand them. That's a great place to put speech therapists too. They're really good at reading behaviors and helping us communicate better with people of all abilities. But now you have to have a doctorate to be an SLP. So what can we do? What can we do to support you all in this critical workforce shortage, which could make such an enormous difference in the lives of all children and lots of people with DDs. Okay, I just wanted to make it really depressing.
Did you say kids have a doctorate?
Yes.
Yeah, that's new.
So PTs, so PTs jumped on the doctorate a while back. Well, it's been at least 10 now, I would say, that you have to, and then speech moved into that area as well. So I don't think occupational therapists have gone that route just yet.
You know, I guess if I was to, you know, look at some other professions in the healthcare space, you look at dentists, you look at some physicians and others, And, you want to create a specialization for yourself and things as a field that you put your time and energy into so that, you can maintain fidelity to your training and education. But I think what you see is after so much time that other downstream professionals need to be able to provide service and bill to, their licensure or their capacity. It's not uncommon that, dental hygienists will always push for an increased role, an increased ability to do things in a dentist's office than they're allowed under current regulations. So, if we, this is just me spitballing, but just what I've observed from other advocacy groups in the healthcare space is allowing people to practice up to their scope of the licensure. And some nurses may not agree with this, but for years, a nurse would be the only one able to administer medications to an adult with a developmental disability in a group home. Laws had to change to allow trained staff to be able to do that. And there are nurses that disagree about that, being outside, that's their scope of practice, for example, to do that. So I think where I'm trying to come around to is if that's the case, and I didn't know that, I think you'll see at some juncture, either some subspecialty come up to try to fill that gap, and be able to bill for it, because you can't create such specialization that there's no access to the service.
So, and I can put something or find something. I do think that there's like an assistant SLP and a PTA, something like that, but they're not able to assess. The assessment and diagnosis and determination of the plans. Again, don't quote me on these things, but those come from the PhD level speech pathologist, the doctorate level PT, and then they are able to implement those plans.
I'm a speech therapist, but not in the Western sense. Poor sense of humor. I'm sorry. Really haven't felt that.
All right, let's do it for our guests on Zoom. Any questions? If you could please unmute yourself and go ahead and ask away. All right, any questions in the room? Thank you all very, very much. We really appreciate it.
Thanks, everyone. Yeah.
Probably just trying to safely remove my.
Yeah.